This is KCFR News. I'm Mike Lamp. The federal government is starting to help people who've been laid off keep the health insurance they had through their former jobs. It can cost hundreds of dollars a month to keep insurance under the federal COBRA law. But now, through the stimulus package, the federal government is paying 65% of that cost. It's also offering workers laid off months ago a second chance to get back on insurance. As part of our series Sizing Up the Stimulus, KCFR health reporter Eric Whitney explains that the details for how to apply for the new insurance subsidy have just been released.
Like millions of Americans, Denver resident Fulon Nguyen was laid off due to the recession. And losing her job meant losing her health insurance, too. A federal law known as COBRA lets workers stay on the insurance they had with their former jobs, but they typically have to pay the entire premium themselves. Nguyen says that's pretty tough when you're no longer getting paychecks.
I was very, very concerned that my payment for COBRA would exceed the income that I have right now, which is mostly unemployment insurance income. And there's no way that I would be able to afford health care insurance on my own, even through COBRA.
In an effort to keep people like Nguyen from swelling the ranks of the uninsured, the federal government is now offering to pick up the tab for 2/3 of COBRA health insurance premiums. When Nguyen heard that, she asked her former employer what it would mean for her.
The HR person was able to give me an estimate quote on how much I would have to pay on COBRA, and I was thrilled because it was something that I actually could afford.
The federal subsidy means Nguyen can keep her insurance for $150 a month instead of $450. Nguyen was laid off in March. The new law says people who lost their jobs as far back as September are now eligible to get back on the insurance they had through their former jobs. There are some details in the new COBRA subsidy that mean it might not work for everyone who's lost a job recently. For one thing, companies may need to charge former employees their share of premiums dating back from the time they were laid off.
They can make a decision to say, okay, you're on, but you have to pay back from when you were laid off, or to say, okay, we're just going to start it from here forward.
That's Dede de Percin of the advocacy group Colorado Consumer Health Initiative. Another issue is the new law says subsidies go to people who were involuntarily terminated, which is not always easy to define. Also, there are different rules for companies with 20 employees or less.
I think the most important thing is if you're considering it or if you turned it down, just to ask questions. Go back to your employer and ask questions because it might be available to you.
Some laid-off workers have already been doing that, but until last week, their former employers haven't had many answers.
I think there's just simply a lot of confusion.
Dave Smith is a staff attorney for the Mountain States Employers Council. He says employers have been jittery ever since the stimulus bill passed in February about what the new law might cost them.
Initially, people think that it's the employer that will have to pay the unsubsidized rates.
It was clarified last week that while companies do have to initially pay most of the premium, they get it back in the form of federal tax credits, a process that shouldn't take more than 90 days.
When they realize that they get that back through a government tax credit, they feel more comfortable with that.
So the subsidy is being paid by the government, not employers. But businesses do have costs. Employers have to spend staff time interpreting how the subsidy applies to them, sending out notices to laid-off workers, and helping them get back on insurance if the former employee chooses to do so.
The issue that the employers have to deal with is why is it us that have to do this rather than somebody else?
No one knows exactly how much this subsidy of health coverage will cost taxpayers. It depends on how many people sign up for it, and that won't be tallied until the subsidy expires at the end of this year. Eric Whitney, KCFR News.